hormones. They have a specific program for that, which is certified. You can see those colleagues who are living in Brussels here from the embassy, they can find this kind of products, for instance, in the French Carrefour market, which has an American flag on it. You can buy it next to beef from Argentina, Uruguay, and from the Union itself. So it's available on the market, but it's only the non-hormone treated beef. The other one we won't allow in.
เดี๋ยวนะครับ
ขออนุญาตกลับมาตรง extrapolate นิดนึงนะฮะที่พูดถึงเรื่องของการ extrapolate ไปในสัตว์หลายกระเพาะเนี่ยในสัตว์4กระเพาะด้วยกันเนี่ยครับหมายถึงเฉพาะการ extrapolate MRL หรือว่า extrapolate ในเรื่องของการอนุญาตให้ใช้ด้วยคือหมายความว่าเป็นการ extrapolate ในเรื่องของ efficacy ด้วยหรือเปล่าหรือว่า safety เรื่องอื่นๆที่ไม่ใช่ค่า MRL ด้วยหรือว่าเป็นการ extrapolate เฉพาะค่า MRL เท่านั้นสำหรับตัวยาที่จะให้ใช้ในสัตว์หลายๆ species นะครับ
Okay, the question is when you one substance, you extrapolate to the other species like a cattle, and you cope with the sheep and goat for only the MRL, or you can, extrapolate for the efficacy of the product as well.
Well, in general, for the MRLs, we will ask for data in turkeys and in chickens. We can extrapolate in between these two if we can see that from residue data that the metabolites are similar. Otherwise, we cannot do. Otherwise, we cannot do any extrapolation. So we have whatever will be the extrapolation, the basis is similarity between residue, similarity in markers, similarity in response. This is the only possibility for us to make any kind of extrapolation.
Claudia, how about the ruminants? We just talked about the ruminant. You said, a big ruminant and a small ruminant is the same?
It's difficult to make extrapolations. It has to be on a case-by-case basis.
Oh,
because
case-by-case basis.
Sometimes the response is not the same. Anyway, coccidiostat, they are not approved in cattle. So they are approved in cattle as veterinary medicines. There is some entrance there. But as a feed additive, only for poultry and rabbits. That's all.
The European Medicines Agency now employs extrapolation for medicines like of all kinds. What you have to show there is that the metabolism on this type of substance is similar between the animals. So sometimes there's a substance that is very much dependent on ingestion via the stomach and has a similar approach, so there are similar systems of metabolization in ruminants, then you can say, okay, that from this point of view, you could say that it's a similar approach. But sometimes, especially in milk, you have different kind of metabolization that leads to the milk, because you know that cattle and ruminants have different fat contents in the milk and so on, and you cannot extrapolate. But we asked the European Medicines Agency via the legislation to systematically ask themselves the question, is it possible because of the type of metabolism, because of the type of species, is it possible to also allow that for the other ruminants? If the question has to be answered no, because we don't know anything about the metabolism in these animals, then we have to leave it like this. So you rely a bit on basic data of science on the metabolism in order to answer that question.
ครับถ้า feed additive เขาให้ใช้เทียบเคียงได้แค่เพียงไก่กับสัตว์ปีกเท่านั้นนะฮะแต่ตัวอื่นไม่มีนะครับแต่ถ้าเป็น medicine หมายถึงเป็น medicated feed นั่นหมายถึงก็ extrapolate ในเคสที่กระเพาะเมื่อกี้พูดกระเพาะ4กระเพาะนะครับ ruminant ก็คือใช้ได้นี่ยานะครับนี่ยาแต่ว่าใน feed additive ไม่มีนะครับโอเคไหมครับใช่ไหมผมแปลถูกเปล่าดร.ศศิเดี๋ยวหาว่าอ้วก Any more question? Yeah, if no question, I have question, Claudia. You're talking about the ABRL. What about the doses of the coccidiostat? You recommend like a lower dose and higher dose, so the MRL that you're setting, rely on the highest dose or not?
Well, we recommend it for a lower dose. We have always a range for the coccidiostat. So for the lower dose, we will evaluate, with the lower dose, we will evaluate the efficacy. With the highest dose, we will evaluate the safety, including the metabolism data, safety for the target animal and safety for the metabolism, and safety for the, residue data. So in the residue data, we applied the maximum level that the applicant requests in all of these studies.
โอเคนะครับเคลียร์เนาะก็คือถ้าเป็นด้านประสิทธิภาพเขาก็ใช้ lower dose แต่ถ้าเป็นด้านค่า MRL ก็ใช้ high dose โอเคไหมครับเพื่อ safety กับผู้บริโภค safety กับสัตว์โอเคไหมครับเคลียร์เนาะครับขอพักเบรกแล้วครับเมื่อกี้เขาบอกว่าเกินเวลาแล้วอย่าถามมากผมเลยสะอึกเลยโอเคนะครับน้องไม่ต้องระวังเนาะเอาก็เบรกเลยกี่นาทีครับ
10 นาทีนะคะ
10 นาทีครับ10 นาที
เบรกอยู่ข้างหน้าห้องประชุมนะคะ
เบรกอยู่ที่ห้องประชุมครับอ๋อก็อยากฟังเสียงน้องอ่ะเลยขอไปครับขอไป
I think maybe the other is because we are
10-minute break.
No, that's okay. No, we don't. I maybe skip this one because the marketing authorization is really not their interest. There's nobody here who wants to bring something on the market in Europe.
Do you hear me? I'm talking to you across the water, across.
Welcome back to the second part of the afternoon sessions. Before we continue the presentation, I would like to request for your assistance in completing the evaluation form.
อันนี้ยกเลิกเอานี้ไปเลย
You have any gift?
Sorry for inconvenience. Okay, before we continue the presentation, I would like to request for your assistance in completing the evaluation form. We would love to hear any feedback or suggestions that you may have for us. On these sessions, we are going to have Dr. Gudrun Gauhoff to share us with the last topic. ขอต้อนรับทุกท่านนะคะกลับเข้าสู่การบรรยายในช่วงที่2ของบ่ายวันนี้นะคะก่อนที่จะเริ่มการบรรยายดิฉันขอประชาสัมพันธ์2เรื่องนะคะเรื่องแรกค่ะทางผู้จัดนะคะทราบมาว่ามีท่านผู้สนใจจำนวนมากที่อยากจะเข้าร่วมการสัมมนาในครั้งนี้แต่ว่าไม่สามารถเข้าร่วมได้เนื่องจากที่นั่งมีจำนวนจำกัดนะคะทั้งนี้ทางสถานทูตได้มีการอัดวิดีโอของการสัมมนาในครั้งนี้ตลอดการสัมมนาค่ะโดยท่านผู้สนใจสามารถดาวน์โหลดได้ทาง www.thaieurope.net ตั้งแต่วันที่7ตุลาคมเป็นต้นไปนะคะจึงขอให้ช่วยประชาสัมพันธ์ไปยังผู้สนใจต่อไปด้วยค่ะและเรื่องที่2นะคะก็คือขอความกรุณาทุกท่านกรอกแบบประเมินแล้ววางไว้บนโต๊ะหรือเก้าอี้ของท่านนะคะโดยทางเจ้าหน้าที่จะเก็บหลังเลิกงานค่ะในลำดับต่อไปนะคะจะเป็นการบรรยายหัวข้อสุดท้ายนะคะโดยดร. Gudrun Gauhoff ค่ะ May I now take this opportunity to give the floor to our guest speaker, Dr. Gudrun, please.
I said to her, it's better convey to you, not pass to me.
Okay.
To save the time.
Yes. Okay. Normally we wanted to do also a presentation on marketing authorization procedures on veterinary medicinal products, but we had so many questions which are also addressing that sort of subject that now I'd rather go to my next presentation on the overlaps. I think that is really the issue that is really interesting for you because it reflects that we have different kind of approaches for the same substances and that this can produce some sort of difficulties in understanding. So I will have recapitulate a bit the risk assessment approach that we have. some of the health-based guidance values, substances, intolerances, and issues that we have with control. So we have the farm-to-fork approach in Europe, and from that farm-to-fork approach, you also have to consider the whole question of residues and substances which may be contaminants, from the perspective that you have an animal that is treated, that is exposed to certain substances in its lifetime for different reasons. So we have animals get sick, they have to be treated. Animals might get sick, so they get additives in order to avoid that, or to have food more palatable, or to digest it better. You also might have animals which are exposed to pesticides because they eat grass or other crops. And you have also a substance group that we haven't mentioned yet, which are called biocidals, which are also potentially substances like disinfectants or substances which are acting also against antimicrobials otherwise, which might add up either in the environment of an animal or in the feedstuff, or there might be also a substance that is intentionally administered to animals. And so from the point of view of control, you might have residues of the substance in the food product that you're not aware of where they're coming from. And the whole approach in categorizing certain substances in certain groups is at some point in time rather academic. And you're doing that in order to organize your market with the products, but not from a control perspective. So for instance, you can look at certain overlaps in substances where you have pharmacologically active substances, which in European legislation normally with their legislation, go over all the other substances. You heard with the contaminants that if something is already regulated elsewhere, for instance in the pharmaceutical legislation, that it will become is not a contaminant anymore, but it will be considered there. We have similar overlaps with pesticides. For instance, ivermectin and permethrin products, they are also used as a pesticide. So if you have a piece of meat, you might not know where the permethrin that is in there, or fish or shrimps. Ivermectin was used also largely in shrimps to avoid this sea lice. If you have that in there, does it come from the crop, or does it come from a treatment of the animals, of the aquaculture fish, or maybe from the grass that a cow was eating? So you have to manage also these kind of overlaps between the legislation. The same is true with biocidals. We have, for instance, many biocidals which are disinfectants which are used in all kinds of products, which are regulated also in legislation in Europe. And there's a tiny bit of overlap, which are the substances which we call like teat dips, for instance, which are used to clean the udder of a cow before you go on milking it, or to disinfect the area where the animals are kept. So some of these substances may also have an overlap. And we have already focused today on a great overlap that we have between feed additives and veterinary medicinal products, which are here, for instance, also vitamins and minerals that can be used also as medicinal products for animals, but also the coccidiostats and histomonostats that can be considered an overlap between feed additives and veterinary medicinal products. I hope that you have understood in this in what we have presented so far, that the fact that currently we treat these two substances as feed additives has a rather a historical background than something that we have thought of from a more in a more structured, comprehensive way. So as we have tried to convey to you, the European system has grown over the time. It has been revised and revisited. but there's still a lot of regulatory ways which stem from the beginning of Europe, where we have only regulated something here in this corner and regulated something in that corner, and all of this is growing together, and we are still in the process of reorganizing and reevaluating the aspects of the different kinds of legislation. So, we have discussed that there are two different kinds of substances. Those which are intentionally used and which we therefore actively evaluate and link to an application, which are additives and medicinal products, but also pesticides. So we ask for an application for an evaluation by those people who are wanting to use these substances. And that on the other hand, we have contaminants, which are products which end up non-intentionally in the product. And this is also the lady before earlier, she was focusing on that with the carryover. So the carryover is also a contaminant problem. So you don't want to spend your more time than is reasonably acceptable in the cleaning of your premises and your equipment, so you have to deal with the problem that there is residues of a former product in the production that you're doing now, and therefore we have established these carryover limits, which are dealing with an unintentional contamination with an earlier product in the processing of feed or medicated feed or a product that is of any kind. So we also have a similar way of dealing with GMOs, where you sometimes also cannot prevent that something is contaminated. But we make the difference between contamination and intentional use, even though the substance may be the same. In this, the above principle is mentioned in the general food law. So above all is standing the objective of a high level of human health protection. We also have to consider consumer interests, animal health and welfare, plant health and the environment. So all of these uses of substances we have to somehow consider and balance out. And as we have discussed in relation to with growth promoters, for us, if a growth promoter is not something so dearly needed as a treatment that is necessary to help an animal to get well again. So we balance those substances differently than substances which really have a clear advantage for animal health and welfare. On top of it, in Europe at least, the approach to the consumer is also, my interest is not to have these growth promoters. It might be different in other constituencies where people say, as long as everything is super cheap, I accept everything. You might have this approach as well, but at least we in Europe we have to consider that at least for the time being, the consumer have a different approach to this question. So we have to achieve a high level of consumer protection in EU feed and food legislation, which on top of it has to be based, and here we are implementing international law, that one of the World Trade Organization, that we have to employ a risk analysis approach, which means that we have to have a separated risk assessment, which is in the cases of substances mostly an assessment of the toxicology according to a specific model. And there we try to employ the models that are used worldwide. And we have to have a risk management which takes into account these kind of objectives that we also pursue in European legislation. As I said, we also trying to incorporate the international standards as far as, from our point of view, it is possible. So we have to look at that our legislation is effective. So we cannot employ international standards if we consider them ineffective or inappropriate for the fulfillment of the objectives. And as I said to you, in our constitution, the Treaty on the Functioning of the European Union, we have an Article 13, which says that we have to take into account, if we create policies on internal market and agriculture, for instance, animal welfare. And also other ethical concerns, which we haven't discussed so much, but for instance, certain traditions and religious considerations we also have to take into consideration. We have to also have a scientific justification. And as you heard, in relation to what Claudia said on ractopamine, for instance, it can sometimes come down to the evaluation of certain studies where you don't agree, and then you go away on totally different paths. So if you say 6 studies is enough for me, or 6 people participating in this study is enough for me, or you say, okay, I need more representative studies, that can tear the evaluation totally into different directions in the end. And most of the time, most people don't go into that sort of detail. They just say JECFA is right, or the EFSA is right, and you have to really go sometimes into the studies and understand what is the problem at the root of this. So they might result in a different level of protection. And as I tried to explain in response to the question on hormone that the colleague had, for us, growth promoting doesn't have the same value as it might have elsewhere. We consider growth promotion more or less something on top that you might tolerate. If the substance is really safe, then you can, and not posing any question, then you can authorize growth promotion, but otherwise you would have to have a higher level of security, of safety, and also a more complete dossier if you want to allow growth promotion, because it's happening every day. It's not only if an animal is sick, it's something that is added at a regular basis by people who don't really know too much about the substance itself, who are only most of the times interested in getting more money out of the process that they're managing. So we have a higher standard on the amount of data that we would need for such substances. So our risk analysis approach is basically starting at the risk scientific evaluation, where we use internationally applied models, mainly the NOEL ADI system and the reference and the respective tolerances based on this, with similar, with international consumption figures that we also consider, depending on the different fields, and also different from the type of product that we are looking at. So you have a different approach in pesticides than you have in contaminants, but this is the case internationally. And we consider other legitimate factors according to what is considered important also in Europe, according to our constitutional texts and the objectives of the treaties and of the secondary law, in this case mainly the food law, food and feed law. So we determine then on this basis, taking all of these things into account, the measures determining the safety in our constituency or country, and this is how we determine the level of protection. And this is reflecting what we have in the SPS agreement more or less as well. So the safety evaluation is according to studies that we are looking at. And we evaluate the substances with, for instance, in veterinary medicinal products. If we authorize them, we establish a withdrawal time that you can see here in these depletion studies, where the MRL is reached at the dotted line. There we say this is safe, and after that, the time that has passed you can use the food as safely for human consumption. We employ a similar approach in the contaminants, but this is more looking at what is focusing on the dietary exposure and on what is has to be accepted in the food, and we establish a maximum level there. So the health-based guidance values are mainly related to what can go wrong, and this is most of the time genotoxic and carcinogenic considerations. If we establish a limit that is not safe and we don't arrive at a safe limit, we look at, can this be creating cancer, or can this be damaging to the genetic material? And there we take either in the substances where we have a managing or an application form where the substances are intentionally used, where you can prevent that from being used by not authorizing them by a pre-market approval, we will not allow them. Or in contaminants, you have to deal with the exposure that is available and reduce it through other measures as far as possible. So according to this, we have different tolerances, and that can lead also that the tolerances are in different types of legislation. So for instance, we have maximum residue limits, most of them for pharmacologically active substances. These are the substances that are intentionally used in mainly veterinary medicinal products. But there may be the same substances also used in feed additives and in biocidals. So, as I said, normally the pharmacologically active substance evaluation is the leading one, so that's the one that is most of the time most developed, and the other legislation will refer to it. The pesticide, there's only some of the substances, and there we have organized that there is a reference or connected to the MRLs that will indicate that you also have to consider the pesticides. So in the regulation 1831, we have a clear indication that either you have to have if you consider in the evaluation, if Claudia with her panel finds out that it would be better to have an MRL, they are obliged to first of all look whether there is already an MRL in the pharmaceutical legislation, which is now the Annex 1 of Regulation 37/2010, which means if you have already an evaluation of a certain cocciostat because you use it as a treatment, the same MRL will be applicable for whatever feed additive is there. So this makes the issue more palatable or reasonable for the control. If we would have different MRLs from different directions, it would be impossible for the control to deal with it. Because you would have to first of all find out where does it come from. Like an inspector would be almost become something like a detective, and to find first of all out where it comes from. Before that, you cannot do anything. So in the biocidal legislation, for instance, which would be applicable to these TDIPs, we have also this kind of reference, which says, first of all, look at the MRLs which have been established according to the legislation on pharmaceuticals. And with pesticides, we deal in that way that we have a reference in the list that I've already shown to you before, in the list where we have the pharmaceutically active substances in Regulation 37 of 2010. There would be a reference saying here with this example, which is alpha-cypermethrin, that for milk, further provisions may be in the Commission Directive 98/82 that have to be observed, and this may